When DJ Brunson tested positive last year, his parents were relieved that he showed no symptoms. But weeks later, the 4-year-old from Maryland was seriously ill in hospital.
It was one of the most gut-wrenching, heart-wrenching. It was just one of the hardest moments thus far in my entire life.
DJ was diagnosed with a rare condition known as multi-system inflammatory syndrome in children, or MIS-C. In Australia, it's sometimes called PIMS-TS. It mostly occurs in kids between the ages of 5 and 13 who've experienced a mild case of COVID-19.
A month later, they're no longer positive, they're no longer shedding infectious virus. They have antibodies directed against the virus, and they have this multi-system disease characterized by high fever, pneumonia, involvement of heart, liver, kidney. It can be quite severe. It can require an intensive care unit admission, and it can be fatal.
More than 6,000 cases of MIS-C have been reported in the United States, including 55 deaths. In Australia, there have been around 30 cases and no reported deaths.
We have worked hard with our colleagues around Australia to recognise some of the symptoms and institute early treatment, which means we've had some good outcomes with managing this condition.
Doctors argue the risk posed by MIS-C is further cause for parents to vaccinate their children as soon as they can.
COVID-19 vaccines have been available to children between the ages of 5 and 11 in the US since November. But so far, only around a quarter of kids in that age group have received at least one dose. That's a figure that alarms many experts, especially as the number of children being hospitalised with COVID continues to rise.
DJ has now recovered from MIS-C, but his parents hope their family's experience will help to educate others.
I really do not want any parent to even go through what my husband and I went through. It again was traumatic.
I think, if your child has an infection and recovers from that infection, then a month later has symptoms of high fever, difficulty breathing, I think they should immediately bring them to the doctor.
Giving kids the best chance of getting better. Jade McMillan, ABC News, Maryland.